Hello everyone, it's Schematic Med. Today we're going to talk about evaluation of bladder dysfunction in children. If the child has bladder dysfunction, we need to do urinalysis. First step is during urinalysis. Bladder dysfunction in children, urinalysis. Urinalysis is a test where urine is collected and first examined for its color, clarity, and smell, then tested with special strips for substances like sugar, protein. Sugar is the glucose, obviously. It would show us the pH, blood, which is the hemoglobin, then ketones, bilirubin, leukocyte esterase, nitrates, urine-specific gravity, proteins, red blood cells, or white blood cells. So that is the urinalysis. If urinalysis is positive, so we found something, we need to treat underlying cause, for example, UTI or diabetes mellitus. If we see nothing, which means urinalysis is negative, and we need to evaluate if the symptoms are nighttime or daytime. If nighttime symptoms only, we say it is nocturnal enuresis. And if the bladder dysfunction occurs during daytime, we need to evaluate are there any warning signs for spinal cord anomaly. For example, red flags can be neurological deficits, for example, lower extremity weakness, hypertonia, hyporeflexia, or cutaneous lumbosacral abnormalities, for example, dimple more than 5 mm long and more than 2.5 cm above the anus, hair tuft, hemangioma, subcutaneous mass, for example, lipoma. And if any of this is present, we need to do MRI, spinal MRI, to exclude or confirm the spinal dysraphism. And if needed, and the patient is symptomatic, do surgical detethering. But if none of the above red flags are present, we can consider vesicourethral reflux, constipation, or behavioral etiologies. I want to highlight this part one more time. Closed spinal dysraphism, for example, spina bifida occulta, should be suspected in a patient with new-onset urinary incontinence, particularly if lumbosacral cutaneous findings are present, for example, hair tuft. Diagnosis is with MRI of the spine, and surgical detattoning is indicated in symptomatic patients. Thank you, bye.